In this video, we're going to look at pathology of cardiovascular disease, which is the seventh key area of Unit 2. Specifically, we're going to start by looking at the first sub-key area, which is sub-key area A. So, if we have a look at these true or false statements first, blood returns from the body through the superior and inferior vena cava, which empties into the left atrium. Blood moves towards the lungs after it leaves the right ventricle. The coronary artery supplies blood to the brain, and the AVN controls the contractions of the atria. Now, I'll tell you for what, but none of those are correct. So see if you can work out what would be needed to correct them. Okay, so blood returns from the body through the superior and inferior vena cava, that's correct, but it empties into the right atrium. Blood moves towards the lungs after it leaves the right ventricle is in fact correct, actually. The coronary artery supplies blood to the heart. That's a National 5 thing. The AVN, which is the atrioventricular node, which should clue you into why this is wrong, controls the contractions of the atria. It controls the contractions of the ventricles. So the AVN receives some signals from the sinoatrial node, the SAN, and that's what controls contractions of the atria. So, in this key area, we're looking at things that can go wrong, pathologies of the cardiovascular system. It's estimated around 7% of men and about 5.3% of women live with a coronary heart disease. Over 7,000 deaths in Scotland in 2013 were attributed to coronary heart disease. So this shows death rate over the different years per 100,000 of the population, strokes, respiratory disease, cardiovascular disorders, all decreasing, which is good, but strokes, respiratory disease, and cardiovascular disorders are all linked together, actually. So what is cardiovascular disease? It is diseases of the heart or the blood vessels, so the cardio, heart, and the vasculature, the blood vessels. So blood flows to the heart, the brain, or the body, and it can be reduced as a result of a thrombus, so this is what we call thrombosis, or a buildup of fatty deposits inside the artery that cause the artery to harden and narrow, which is called atherosclerosis. So blood clot is a thrombus, and atherosclerosis is this buildup of fatty materials. We talk about each of these in its own little key area as we come up. So atherosclerosis is an accumulation of fatty materials, mostly consisting of cholesterol, fibrous materials, and calcium, which form what are called an atheroma, or plaque beneath the endothelium. So if we think about an artery, for example, we have the hole in the middle, which is the lumen, where the blood is. We then have the endothelial layer. After the endothelial layer, we have the connective tissue and the muscles. But between the endothelium and the connective tissue, we as a human can store cholesterol and some fibrous materials and things underneath the endothelial lining. It's an evolutionary step to give us a brief kind of transient storage capacity of these kind of things, and also because cells require things like cholesterol for building cell membranes, it's useful to have it really, really near. But if you put it there and then don't use it, and it just gets stored and stored and built up and built up and built up underneath the endothelium, that's going to start to kind of bow in because the connective tissue and elastic fibers are quite strong. So as you pack more and more under the endothelium, it's the endothelium that's going to start to feel the pressure, and it's going to be pushed in, and it's going to cover up part of the lumen. So you can see here, this blood vessel should be a nice circle, but the endothelial layer is getting pushed in, and it's decreasing the size of the lumen. And you can see this here. So there's the endothelium, and then underneath is this massive cholesterol plaque. So how does that occur? Initially, plaques are composed of fatty materials, so mainly cholesterol. So this is what I've just said. As time goes on, however, your body doubles down and adds fibrous materials, calcium, more cholesterol, and it makes it more of a permanent structure. So less of a temporary store of fat and more of a permanent structure. As this atheroma grows, it causes the artery to thicken, it loses its elasticity, and it provides quite a lot of pressure in on the endothelial lining. you get the diameter of the lumen being reduced and reduced and reduced, and that blood flow becomes quite difficult to get past the endothelial blockage. And that means that if you want the same amount of blood to go through per second, but you've got a smaller aperture, which is what we call it, smaller whole lumen, it has to go through faster, so at a higher pressure. So a normal artery should have this big hole, and a plaque pushes in and decreases the size of the lumen. You can see lots of pictures here showing that. So there's contributing factors to the development of atherosclerosis. There's high blood pressure, carbon monoxide in cigarettes, diabetes, and high blood cholesterol levels. So atherosclerosis is the root cause of lots of different coronary vascular diseases. So there's coronary heart disease, CHD, which we talked about before, there's strokes, which we talk about the mechanism by which this happens later in the course, there's peripheral artery disease, and there's things like aortic disease. This is a nice picture here. So it asks you in the booklet to draw a diagram of the atheroma in an artery. On your diagram, make sure you mention what the atheroma is composed of, so initially cholesterol, then also your fibrous materials and other things, calcium, and describe how it affects the artery. So what happens to the diameter of the lumen, what happens to blood flow, and what happens to blood pressure. So you want to then construct a line graph showing the deaths from coronary heart disease for Scottish women and men aged 35 to 70, and then draw a key to distinguish between the lines. So this will be included for the assignment as a picture, so you can use that. So again, you're going to look at tables 13.1 and 13.2 on page 176. So again, I will include this. What countries have shown the greatest percentage decrease in deaths from coronary heart disease in women from 1999 to 2008? What country has shown the greatest percentage decrease in deaths from coronary heart disease in men from 1999 to 2008? Suggest two reasons for the decrease in the deaths from coronary heart disease over the 10-year period. Which European country is the only one which has not shown a decrease in death rates from coronary heart disease? If you feel like an extension task, have a look at the British Heart Foundation leaflet on coronary heart disease. So Google British Heart Foundation coronary heart disease. You could then select data from the leaflet and present it in another format. So try and convert it into tables or graphs. This task is mainly to get used to data handling for the exam. So it's quite a useful thing to do. You can use your data and perform a calculation, percentage increase, percentage decrease. Okay, in the next lesson, we're going to look at making what's called a thrombus and an embolism, and the effects this can have on the body. You may already know that this man looks like he might be having a heart attack. You can see here some damage to the heart muscle, and this is a picture of red blood cells. Okay, so hopefully that helped. Have we look at your booklet and complete the tasks.